Today we are going to discuss drug acting on skin and mucous membrane. There are different topics. We will discuss one by one: demulcent, emollient, absorbent, protective, astringent, counter irritant, caustic, and keratolytic. First one is demulcent are inert substance which smooth and relieve the irritation. We can use inflamed and injured mucous membrane. They form a precipitated layer over the irritated surface. They may also be applied to the skin. Most demulcents are water-soluble compounds with high molecule weight. Example of demulcent: gum, acacia, glycerin, propyl glycol, methyl cellulose, mucilage of starch. Demulcents are used to lubricate and protect the elementary mucous membrane. Now we see mode of action demulcent. A demulcent is a high molecular weight compound in aqueous solution. Glycerin is a popular vehicle. It is a hygroscopic agent that is absorbed into the skin. Similarly, propylene glycol is a good vehicle miscible with water and dissolving many essential oils. Linoleic acid is important for the barrier function of the stratum corneum. Look at here, kaolin, which commonly use antidiarrheal compound in the treatment of diarrhea. And now next topic is emollient. Are inert oily agent which soften, smoothen, lubricant and protect the skin or mucous membrane against irritation. They treat the dryness of the surface by preventing evaporation of moisture. Emollient may be used in lotion, cream, ointment or gel to prevent or treat dry, rough, irritated skin and other skin problems. Mode of action of emollient: soften the skin by forming an occlusive oil film on the stratum corneum and decrease the transepidermal water. Because of that, decrease the transepidermal water loss and helpful in the dry skin. Three category of emollient product. One is animal product, vegetable oil, petroleum product. Now we see the absorbent and protective. Absorbent are fine powder, inert, insoluble substance which can bind to irritant substance. When applied on the skin mucous membrane, they lessen the irritation and protection to the skin. Protectant can be further divided into three subclasses: dermal protectant, intestinal protectant, and occlusive. Example of calamine, bentonite, boric acid, and zinc oxide. Now we see the astringent. Agent which precipitate surface protein and form a protective coating over the inflamed surface, skin, and gastric mucosa. It is a help forming a protective layer for proper healing of the underlying wounds. Astringents are used to precipitate the blood protein. When used to coagulate blood, astringents are called as styptic. Astringents are broadly two types of. One is a mineral astringent, another is a vegetable astringent. Now we see the counter irritant. Counter irritants are are agents applied locally to the skin to cause the irritation and hyperemia to relieve the pain and promote the healing of underlying tissue. When counter irritant is applied to the skin, localize the irritation of the affected nerve and being produced the arterial dilatation. They increase the blood supply to affected tissue, resulting in the greater concentration of the deficient cell. They are useful into the chronic inflammatory lesion and joint pain. Depending on the intensity of the irritation produced, the counter irritant are classified as follows. First one is the rubefacients, causes mild irritation and or redness in the local skin area. Example of the liniment of the turpentine ammonium. Second is a vesicant, causing the localized vesicle or blister by the severe irritation or damage to the capillary. Example of the red iodide of mercury. Third one is a pustulant, causing the severe inflammation even of deep-seated cutaneous tissue and causing the pustule. Example is the proton oil and strong ointment of the red iodide of mercury. Now we see the caustic. Caustic are topical agents that causing the destruction of tissue at the site of application. They are used to destroy the excessive granulation, keratosis, and hornburn in cows. They may also be used to remove the mold, wart, and papillomas. Example of the caustic soda, potash, phenol, copper sulfate. Now we see the keratolytic are agent which dissolve the intercellular substance in the horny layer of the skin used in the treatment of the hyperkeratosis. They are used mainly on the hyperkeratosis lesions such as the corn, wart, chronic dermatitis. Important agent of the keratolytic: salicylic acid and benzoic acid. Thank you.